Care with Belmont Village, Geneva Road, and Carroll Stream. I also want to introduce to you a couple other people that we have on this call. So first we have Jody Weinberg and Debbie Lapin from Belmont Village, Buffalo Grove, if you guys want to wave. And we also have locations in Oak Park, and we have one in Glenview and Lincoln Park. So we have 5 Chicagoland Belmont villages, and we provide assisted living as well as different levels of memory care. We also have a sheltered care license, and many of us have sheltered care licenses, and we can do up to a 2-person transfer or assist. So if you're interested in that information, you can certainly give us a call. I'd like to let you know we are going to be recording. We already are recording this presentation. So if you know of anyone that's interested, we are happy to pass it along afterwards. I will ask as a participant that you put yourself on mute and also turn your camera off. And if you do have questions throughout the presentation, if you would please put them in the chat box that's at the bottom of your screen. You can type in a question, and we're happy to, Jean is happy to answer that as she goes through the program. So this program is called Having the Conversation, Making Decisions with Aging Parents. And I want to introduce our speaker to everybody. So her name is Jean Llamas. She's with Care Navigators. And Jean has a ton of experience. She's the president and owner of Care Navigators and Care Guardians. She's worked 21 years as a registered nurse, and she founded Care Navigators to help patients and families navigate the complex healthcare system, a service gap she uncovered as a working nurse. So please, Jean, go ahead, and we're very excited to hear your presentation. Thank you.
Okay, excellent. So this is Having the Conversation, Making Decisions with Aging Parents. Basically, my background is nursing, just like Erin said. And I will get into a little bit about what we do, because we can be an assistant to you or your loved one or a community as a care manager, not just Care Navigators, any care manager. So it's always very generic. So what are we going to talk about today? We are going to talk about what is assisted living, very basic. We're going to talk about a big overview of what is memory care. But what I really want to get into today is what is the parent-child dynamics and psychology that happens between families. We're going to talk about how do you have a crucial conversation, important conversation with your loved one. It doesn't have to be mom or dad. It could be a kid. You can take this context for pretty much any kind of conversation you want to have with anyone. We're going to talk about creating a plan to do that, executing that plan, right? Like delivering. And what does a care manager do to help you? Again, I'm not here to market Care Navigators. I will just say care manager during it. And you'll know that that's what I'm talking about, is it's just another level of professional that can assist. What is sibling rivalry? That's always interesting. And then we're going to do an interactive demo, but I do need a participating audience member. And I do see some of you on here are from communities, so I'm sure somebody would be willing to do that with me. So instead of asking now who's willing to do that, we'll wait till we get to that. Otherwise, I'll pick on you. So what is the basics of, I just want to focus, there's 7 different levels of care that a lot of families don't understand. But a lot of times, once a client, a family member is noticing that someone is needing more assistance at home with ADLs, and ADLs just mean activities of daily living. What does that mean? Cooking, cleaning, bathing, dressing, shopping, transportation, getting up from a chair. Basically just help around the house. So the basic of assisted living, usually there's all these levels of care, but most people fit, that's where I was going, into assisted living. And a lot of times memory care also. So when we talk about Belmont Village, they provide both of those services, and what they do with their assisted living with memory care is unique. And I know that that's not my expertise, that some of the ladies that are on the Zoom with us, but I'm going to just basically go over what the difference is there. So assisted living means you will get healthcare access. What does that mean? Nurses, nurses' aides, various doctors, You will also get therapies on site. So if you do fall, if you do, or your loved one has any kind of issue, was at a hospital, had some kind of heart issue and isn't walking as well or doing as well, managing their blood pressure, et cetera. There are those therapies on site, nursing, social work, physical therapy, or they can bring them in. So we won't go into the difference between outpatient care and skilled home care. Just know that this community, assisted living, can bring all those services to you. Big goal is safety, right? Why do children start talking to mom and dad about this? They're worried about their safety. It really is out of concern. There's also super fun activities, anything from bingo to music to going out to transportation to the casino. They have happy hours at some of these places, et cetera. And you get transportation within means. It has to be within a defined area. But if not, there's transportation services that they help connect you with. You also get meals. Guess what? No more cooking 3 meals a day, especially if it's 2 people living at home and one is really struggling. Say, example, you're doing well, but your spouse is having a hard time. So you can have meals that are provided. So what is memory care? Think of assisted living, and there's this addition is memory care. And that's where we get into Belmont Village. So memory care means there's something going on with that person's cognition, their memory, how they're thinking. It could be dementia. It could be like a stroke that has caused some dementia. It could be Lewy body dementia. It could be anything where memory is affected. And what it is it's provided, it's care that's provided like an assisted living with that concept of understanding that someone has some memory issues. And what do? They do exactly the same things we just talked about in the other slide, but they're also working with the dementia. And what's different with Belmont Village compared to some assisted living memory communities is they do different levels. And they can tell you all about the different levels and how that works, but just know if you are thinking about a loved one that needs to go into memory care and you say, but they're really not having too much trouble yet, they will put them in that right area with their like-minded peers. What are peers? They're people that are on the same platform or level as that person. If they're more severe and they have some behaviors, and I don't even like the word behaviors, but it is still used right now. What does that mean? Somebody with dementia that might be nervous, so they have anxiety, might be paranoid, so they think that things are happening that aren't. They might have depression. They might be erratic in hitting stuff. There is so much training, especially in a memory care community, how to work with that, whether it's distraction, whether it's obviously keeping a quieter environment, or do we need to go on medication because that person's brain has changed so much. They don't even know what Zoom is, who we are, that we're people, that this is a face, that these are my hands. They're afraid of everything at some point when it gets pretty severe. So working with a memory care community, they're going to also do activities that are within that realm, especially at Belmont, the different levels. You have someone that might be mild. We can do some more intense Scrabble games. We can go on a lot of outings. We could do more. But as it gets more advanced, sometimes people they're looking at children's books. They're looking at, they're playing with a doll. I mean, when it's very, very advanced, these things are comforting for them. And they keep a calm environment. So I try to break that down just to start. I can go into a lot of detail on what is dementia, et cetera, but our focus is on having that conversation with someone, with the loved one, when you think that they need more care. So some general info. We are aging in the United States and in the world. So 2015 to 2050, 65 and up, the age up, 65 and older, is going to be from 900 million to 2 billion. So we're going boom, 12% to 22% of this world is going to be in that age group. So they're going to need care, and we're going to have to redefine what does that look like. 43 million people are providing care to their loved ones and they're not getting paid in the US. So that means that there's a lot of people like our spouses or daughters or sons that are helping their loved one, and they're having to do this, and it's taking hours and hours a week. And they're doing that without any type of compensation. So that affects their work, that affects their psychosocial, that affects their ability to go out and get groceries for their family, etc. 90%, this is an important statistic, 90% of elder abuse is by their children. It's at the hands perpetrated by their kids. A lot of it is financial. So it's so important to start planning for people with memory issues, whether it's your loved one, wherever you're at in the family, if you're the daughter or the son, so you can protect your loved one from that. Half of adult children help parents right now with household work if they're between the ages of 65 and 74. 64% of kids are helping people that are over 75. What does that mean? That means here in the US, most of us are a caregiver, right? A huge percentage. 8 out of 23 older adults don't tell their kids about healthcare issues. They say because they're worried, they feel guilty putting a burden on them. And the number one thing from some studies I read just before doing this presentation is they feel like my daughter or son already has their own kids to take care of. But if you don't get these questions, concerns, conversations, and plans in place early, the burden will be worse on everybody. So how does a care manager in general get involved? So it depends on the, what type of care manager they are. Some are nurses, some are social workers, some are just healthcare advocates. They're people that care about taking care of others because they've done it for their parent. So what do they help with? Families who are fighting. Lots of times there's daughters and sons. I'd say most of us are from dysfunctional families. Somebody is not in agreement for many reasons. We'll get into that. They can also help with education on dementia, on the different levels of care. There's about 7 levels of care. I'm sorry, but it really does have a lot to do with finance so that you can understand what can you afford, not afford. And if you can't afford, let's put those places or those priorities in order about getting on Medicaid if it's a pathway. Medicaid means, we need some assistance from the state. They help coordinate with communities, and they should be an advocate for you and the community to get paperwork done, to get your tests that you need done, to get the doctor to fill out the paperwork, any forms that are needed, making sure a POLST is in place. And what that is the new DNR. And I hate calling it that because not everybody's a DNR who has a POLST, but what it means is, what are your wishes if something happens medically to you? They can help you get the correct dementia diagnosis. I see that a lot. Psychosocial support, especially. This is overwhelming, taking care of someone who's declining, whether it's with memory issues or just in general from any kind of health disease. They're actually the perfect partner for your loved one. They will never, ever, ever listen to you if you're a daughter or son. Rarely. I actually had my mom listening to me, which is shocking. She was very, very stubborn, but it was many, many, many conversations. And we'll get into that, planting seeds before I was able to do that. But most of the time, they're going to listen to someone outside the family who's a professional. And sometimes the daughter, the son, the wife, whoever it is, they can be looked at as they're the bad guy if they bring up the conversation. And with clients who have memory issues, if it's severe enough, that replays in their head a lot. And that's all they keep thinking about is that you said this, you did this, and then they can't remember everything. So they start building a story around that. So, sometimes it helps to protect the family member. So crucial conversations, what does it mean? It's a really hard conversation to have. Every single one of us have had one. Just had one recently with a family member because they needed some assistance with their loved one with some mental illness issues. And how did we bridge that conversation? Start it early, be non-threatening, try to get some education around what it is. So if we're attempting to move someone into a community because we think that it would be best for them, we need to get education on that community. Keep your words positive. What does that mean? It means you want to come from an idea of what do they want? What is their goal? What would they wish? How do they feel about your relationship with you and getting some support? Do not use the word nursing home. Assisted living and memory care is not what people think it was, from 30 years ago, where people were laying in a bed and, nurses are in and out of the room and people are not getting up and trying to use the right words. There might be an odor in there. That is not assisted living memory care. It's a way to embrace your independence, keep your independence, and live and get that activities and things right there where you need it in the same building, especially if you're not driving much anymore. But you got to keep positive words. The most important thing, especially if you're dealing with someone with memory care, is keep it simple. Keep it simple. I find all the time that people want to tell their mom or dad, because especially with memory issues, they think mom or dad is who they were 10 years ago, 20 years ago, whatever. And mom and dad, brilliant people. They have those days where they're right on point and they can talk with you in dialogue. And then the next day, they don't remember who you are as the daughter, right? So you cannot go into this big, broad range of information. Keep it simple. Use open-ended questions. What does that mean? It means saying something like, how do you feel about aging and what are your goals? Keep it open. A lot of people are going to tell you that they want their independence. Yes, they do get their independence. Focus on that. Even if the patient is so not independent anymore, or client, I should say, and autonomy and making their own decisions. There are a lot of decisions that they can still make, and they should feel like they're in the driver's seat. Somebody's got memory care. Are they truly in the driver's seat? Can they truly make all their decisions? No, you don't need to tell them that. I always used to, when I'm working as a nurse in general with anyone with memory issues, or somebody who's a little bit obstinate, is talk to them like they're the boss. Whatever the word is, you kind of get a feel for people and what word is like, especially like say somebody who I've met nurses, like I'm a nurse and they've been a nurse their career and now they're 90. And I'm thinking of a lady and, she was struggling, but she didn't think she was. And I'd say, you're in charge, because she was used to being a charge nurse. And so that was the right word to resonate. You have to get everyone on the same page. This is the hardest part with families generally, especially if there's a lot of kids. If it's a child, one child, like there's no siblings, they have it even harder because they have no one to share in caregiver responsibilities. They have no one to bounce ideas off of, and they don't have the type of support that brothers and sisters do. So that's even harder. So if we're going to create a plan, we're going to go in and have a crucial conversation with mom. First, we've got to plan it. So you definitely need, if there's a bunch of siblings, a bunch of kids, there needs to be meetings. And maybe it's not just one. I'm telling you, most of us come from dysfunctional families, right? So generally we can go by siblings, we can go by financial. There's a lot of different things that go on in these meetings. One of them is sibling order, right? But it's not necessarily 100% true, but generally the oldest child is usually the one that's kind of the one more forthright, more in charge, taking the notes, the one that would talk to mom or dad. There's the middle child. Not always, but sometimes the middle child, they feel like they're more in the middle. They might not be the take charge one, but they're not necessarily the youngest, and they don't always feel like they're always the one that's heard all the time, right? I think we got someone who has to go on mute. Then you'd be taking possession on the 30th, so you can get. Let's see who that is. We got him on mute. Okay. So the sibling order, then the youngest tends to be the one that is like, whatever you guys decide. That doesn't happen in every family. Here's another scenario with families, and it's very true. And I speak the truth. When I read and did the research on how to talk to somebody about these things, I didn't agree with it. It was very vague. It was very generic, and it was very happy, joy. It is a difficult conversation. And one of the things that people don't like to talk about, and I know we've all seen this if you've worked in the senior industry, is that somebody in the family, not every time, but often, what did I say? 90% of kids, when they find there's abuse, it's the children that are doing it. It's generally financial. Sometimes it truly is not, I'm going in and taking money from my parents' bank account, but it's that child that has always relied on their parent. They needed the most help. The mom and dad are still like paying the rent or letting that child live with them. And usually in the meetings, that child, they might not be a bad person, but they rely on that finance. And you can bring that out with that person. You've got to do it gently, that we understand you're going to need help too. Let us help you. But that's got to be a series of conversations, especially if it's a sibling. If I'm in a meeting, or some of the professionals that are on here, we can kind of see the child who might be a little bit resistant. They're worried about mom or dad doing something where they can't be in that house because they don't know what they're going to do financially. Let's have that conversation and let's help plan for that person. There's all different types of programs out there for all different type of age groups, right? And we can figure out a way to make it work. There's the person of there's usually, not always, but in families, there's scapegoats. There's that one kid that, whatever, either they got into trouble when they were young and everybody thinks they're going to continue to be in trouble, or they're the healthy child and they're the ones that said, this is a little bit dysfunctional, my whole family. I'm going to go kind of do my own thing and live my life. And if I'm needed, I will come back. So that child is not going to be the best one ever to have that conversation if they're the bad one, the scapegoat, with the loved one, whoever it is. But there may be a child like that in the family, especially a dysfunctional family. And we're going to get a little bit more into siblings too, and I'll touch on it again. So what do we do when we plan? We want to plant seeds. You can't just go and think you're going to go sit down with mom or dad or with your spouse and say, you know what? I think you're having a hard time here. I can't manage this anymore. I think we need to think about a community. It's maybe they fell and you say, you had to call me. You didn't call 911. I understand that. I drove over here. Thank God I have a key. I'm the daughter. I was able to get in. What do we do next time? Well, I just call you. I work full time and I have kids. So it's planting seeds. Those are real seeds. That's what I said when I read the research and what to say and do. I didn't agree. You have to gently tell your person, I'm worried about you, and do it so that they can see that also. And you just keep doing that little ways. Or I really want to go and see my friends all the time. Say I'm an older adult, but I can't see at night anymore. And so I can't drive. Well, your 4 of your friends live here at Belmont Village, and you wouldn't have to drive to see them. They're there. So why don't we go visit them? Don't say, let's go move in there. Let's go visit your friends. But, and then maybe the next conversation is, have you ever thought about doing a tour just to look around the building to see what your friends, how they live? It's got to become that person's idea. You have to make sure there's a power of attorney in place. And power of attorney is tricky, especially when you're doing memory care. There are 2 different types. And as long as you have one, it's fine. But there's the immediate, which is a checkbox on your power of attorney. They go into action right away. Even for me, I get into a car accident, I hit my head, I don't know what's going on temporarily. My power of attorney will go into effect for that short time until I regain cognition. Because the hospital's got to talk to somebody, right? If I hit my head and I'm at the hospital. There's also powers of attorney that go into effect once the doctor deems that you no longer can make decisions for yourself. And that, obviously, that can be documented. I can answer questions about that. So what do all of us do? Every single one of us on this call, we're all in denial about something, right? In denial about our age. I'm 50 years old, but a lot of women, they don't embrace their age, and they lie about their age or whatever it is, right? That's cultural things that we've been taught, right? Getting older is not great. I think getting older is fun. Romance, marriage. How many times do you listen to your friends talking about their marriage and how terrible it is. But then you'll say, well, how are you helping yourself? Oh, everything's fine. It's denial. People that do drugs, people that drink too much, people that are overweight. Americans in denial. We're all in denial a little bit about something. So what happens when we need care? We're in denial. Do any of us on this call ever want to think that we're going to need help? Absolutely not. What do Americans believe in? Vitality. They believe in living forever. We know we're not going to live forever, but we don't want to think about what we need when we're older, or how to plan for a death and things like that. So there's denial in care. And I'm probably going to be one of the worst ones, being a nurse and helping older adults. So my children are going to have to get really good at crucial conversations. One of the biggest issues, and I'm sure that all of you have seen this, is long distance family. So this could be from a professional standpoint, or this could even be, say you're the spouse and you have two daughters that live here, and I'll just use daughters, and a daughter lives in New York. The daughter in New York doesn't see dad every day. Talk to him on the phone today. He's having that good day with dementia. And they'll say, I don't see why you're thinking about moving and thinking about a senior living community or needing care at home, just care in general. They are doing fine. So there's also, because they live far away, there's guilt, the guilt of not being closer to help. So then that little guilt and that denial kind of like flickers around, and it translates into worry. And then when they hear that their loved one's doing good, they can get back to their life for a little bit. It's not that they don't care. They can't see it every day. And there's a lot of guilt and worry. Inheritance is huge. This is not me. I'm just telling you that when I meet with families, and when some of us professionals do, they are very concerned about what everything is going to cost, because they are concerned about how much money they're going to get. Two friends I have recently said, oh, my mom and dad, they don't want too much because, they want to make sure that I get my inheritance. This is your loved one's money. Now, if that's their wishes, you need to plan even more than. If your goal is to give money to your kids and you want to do some things to protect your money, whatever you want to call it, there's loopholes, and you don't want to use it for your own care, that's up to you, but you need to plan that early. You can't plan it a year before, 2 years, 3, 4 years before you need that care, because now we're looking at Medicaid, and that's a whole nother conversation. But when the children are saying that's my inheritance, that's they never say it outright, but you can tell. As a professional, we can tell who's concerned about the money because they're thinking about how much they're going to get later. Another piece of denial in care is finance. People don't understand the costs that are involved. Is it more cost effective to live in a community than at home? There's studies out there that show that, yes, there definitely are, because you don't have taxes, you don't need lawn service, you don't need as much transportation, you have everything in the building. So, but it's individualized. Do you have the finance to move to a community, and how do you do that the right way? You plan early. Even if you think you're never going to need it, plan early so that you know the costs and you can figure that out and create a budget around that, so that you can be somewhere that is safe, that has services there. And actually, clients that live in communities, they do feel better about their independence in that, because they're not calling their daughter at 3 a.m, at 6 o'clock at night. Not that that's a bad thing. It depends on what your plan is. Some people prefer to stay home, but you got to plan that. And finance is a big part of that. And if the finances aren't there, then we do need to think about and plan for a Medicaid pathway. Okay, going back to denial. So what is the risk of not doing anything? Not having the conversation early with your loved one, not planning for it. Oh my goodness, the money that you are going to throw out the window because you're overwhelmed and you're emotional and you're trying to get information while you're emotional and overwhelmed. That's an easy time to get scammed by, these solicitors that call. I get them every day in my email, right? I know all of you do. I got a scam and they said they were from Bank of America on that. You're putting yourself at vulnerable risk for other bad things to happen. If your loved one has memory care issues and it's pretty severe, they are definitely at risk for any type of fraud with money, somebody coming to financially exploit them. But it's also going to cost you a lot more money trying to figure out solutions, because what I find with families is they're going to all these different professionals that only know their one part in healthcare. They don't go to someone who has global expertise, that knows insurance, that knows equipment, that knows costs, that knows, level of care, that can assess you for that right level of care, et cetera. And that's where you would bring in someone from a community like Belmont Village, a care manager. Your physician can help. Your physician more, they might not understand the levels of care and costs involved in that, but they can definitely help you with your loved one about the medical diagnoses and if it, do we need to do anything for that person's behaviors with dementia. So it does take a team behind you, but money will be spent. The psychosocial toll emotionally on a person handling this by themselves is beyond overwhelming. I have seen people on the brink of, especially daughters, and it could be sons too, because I've seen it also, but on the point where they're almost ready to have a mental breakdown. And then of course, what I say is super important for anyone that is working either with people that, like myself, even a professional, that are working with people that need help with all of this, or if you're the spouse of someone or you're the child, get counseling. It is covered by your insurance. And counseling can be provided on the phone or it could be in person. What is it? It's bantering about what's going on with you emotionally and reframing it and getting support. And a lot of what support people need is there's a lot of guilt involved as the caregiver. So you need that support. Medical complications. If you do not realize that your person has dementia and can't speak up for themselves, here's an example. They're in the hospital, they have a fall, and they have a lot of pain in their foot. And they could say, I have pain in my foot, but they don't remember or know how to say I have pain in my hip. And they don't have the wherewithal to point to it, right? And they don't get the x-ray of the hip. They only get the x-ray of the foot. And now there's a broken hip and we don't get that repaired. And now we're walking on it. And now the hip's worse. And now they're more immobile. Now they're ending up, things like pneumonia can happen. So medical complications, if not planning ahead, are very real. The other thing is you want to make sure you have what I said before is that end of life paperwork, that DNR, I don't like calling it that, or what the newer word is POLST, POLST, which says, these are the things I medically want or don't want. And guess who looks at those? A paramedic, a nurse's aide, a nurse, an administrator at a building, and the doctor. But who's going to walk in to see you first at your home? A paramedic. You want the piece of paper that says what you want or don't want, which can be done by a advanced practice nurse or by a physician. Family conflict is going to happen if you don't plan early for your loved ones, especially with the kids. Why? All the sibling rivalry starts, the sibling order, everything, the favorite child syndrome, and it goes on and on. So with the siblings, we talked a lot about it. The reason I focus on that, that's who needs a lot of meetings before the meeting with their loved one. There's disbelief usually in a lot, like one or two of the kids. They can't believe it. Either they're too close to the situation. They may be someone who's always kind of more sweeps things under the rug. Or they might have that financial pull on mom or dad. Another thing is, I see this a lot. Somebody was diagnosed with MCI, mild cognitive impairment. Sorry, I wrote behavior, it's impairment. So people think, well, they're fine. They just have a little memory issue. The studies indicate that generally over so many years, it will lead to dementia. I have also seen where someone really is in full-blown dementia, but it may be a primary care physician who doesn't feel as comfortable diagnosing dementia, but can definitely see the mild cognitive impairment. And we talked a lot about siblings. So when we have this conversation with our loved one, and I'm going to look at our time. I know we were 15 minutes later, so I'm assuming we'll go to 1:15. Aaron, you can jump in and tell me yes or no.
Whatever works for you, Jean.
Okay, because we still need to do some role play. So what are we doing when we have that with our loved one? Don't make this a big to-do the first time. Do not have the family member, maybe that mom or dad doesn't get along with, being a spokesperson. They should not be at all. You're just going to strike out. It may not be best for the daughter or son. It may be a representative from, example, a Belmont Village or a care manager or both. Obviously, Belmont Village, I'm not sure if employees go out to a house and can spend a couple of hours off and on getting to know everybody and doing that. Maybe they can, but the more professionals you bring in can be better, unless you have a very functional family where everyone is la happy joy and gets along. I wouldn't make it a big plan unless mom or dad has been resistant for months and you can't get together. It's very important to get everyone in one room. And I'm gonna tell you why. In dysfunctional families, what happens, and like I said, most of us come from them, whoever is either threatened or doesn't see mom needs help or dad needs help, or has that financial pull, or doesn't like to deal with things, or just likes to stir the pot and manipulate. You do not want them doing that. That's why the siblings got to get on one page with mom or dad. Whoever needs the help is the person we're talking to. It might be mom and dad, right? Use non-threatening words, positive words, community. It's not a nursing home assisted living. Use, empowerment, independence, things that would speak to them. You're in charge. What do you think? You want to keep it in a non-threatening place. So say everybody gets together. I grew up in an Italian area. I'm not Italian, but everybody gets together for Sunday dinners. For a spaghetti. I'm thinking about one of my girlfriends. They get together every Sunday. So do it at a dinner and keep it open-ended. So you want to use that open-ended conversation like, Mom, you called last week. You fell. I was worried. Thank God I had a key, but Jim that lives next door doesn't have a key. That might be the kid that doesn't get along or whatever it is. You don't say that, of course. You just say, Jim doesn't have a key. And what would happen? Because I travel for work 3 times a month. And what can we do to make that better for you? Because we have to have a plan. If nothing else, you might not get to this conversation about talking about getting a caregiver in the house, because we can get care in the house, or moving to a community, but we can start the ball rolling, right? Depends on how difficult the family dynamics are, but you got to have everyone on the same page. Make sure the person, it doesn't need to be the oldest child. It has to be the person they trust as the speaker. So the kid they trust, maybe it's the doctor. Maybe it's, I've read about clergy, like somebody in the church. Maybe they're willing to come. Maybe it's a best friend. Thinking about somebody whose best friend was truly the only person she would listen to. And this was a woman that was demented, alcoholic, drinking to where she was passing out, would call the friend constantly, hoarding, spending all her money. As long as the friend said what was needed, it got done. And when we're working with someone with memory care, this lady had memory care issues, right? She was demented. She was very, very severe. She really wasn't able to make as many decisions, but we always want to try and help people make some decisions. We needed a decision maker, and the power of attorney didn't really understand their role in this whole thing. Use it as a future event. A lot of times I meet clients, and they're hardly walking well, and they're like, I don't need anything. I'm independent. Guess what? Yeah, absolutely. You're independent. But if you ever did need something, since I'm your power of attorney, since I'm your daughter, whatever the language is, what would you want? Ask about what their wishes are. Ask about, I can't tell you, I'd say every single power of attorney I've ever met, except for maybe 3, and I'm talking about power of attorney for healthcare, knew exactly what mom or dad wanted. And they didn't have that form in place, the PULSed form. So they were going to have everything possible done to them before they got to the hospital. They didn't have a DNR in place, and that's what they wanted. So powers of attorney, they need to know what the loved one wants. And it's very unusual. So, with my own mom, I started the conversations really early. I wasn't the favorite child. My brother was definitely the favorite child. But she knew I was the nurse and I kept it non-threatening, and she wanted me to go on medical visits with her. That's how I started. Then I said, Mom, you are very sick. She had a lot of respiratory issues. You want to be resuscitated if something happens. You've said that to me. You want me to, she would say, Jeannie will pull the plug if needed. I go, I don't want to make that decision. I want it to be yours. And I want to know, how long would you want to be on this breathing apparatus before it was done? We sat down. I mean, that took a year to get to that level with conversations. Use open body language. Do not look threatening. If you're working with a dementia client, I use smiling. You know, I make it their idea. I live in their reality, whatever they're telling me. You know, if it doesn't even make sense, it's okay. You know, they've had changes in their brain that they can't think like you and I go with it, you know. So that's part of that. So I would like to find somebody who would be willing to maybe banter, and we can try this. And I could play either role, but it would be better for whoever's going to do this with me would be the adult daughter or son or spouse, to have the conversation. And I can play the negative or obstinate or whatever you want to call it person, with dementia that doesn't want to budge or do anything. So the way that we're going to do this, so I have to have a volunteer, is and we'll talk about this slide after, but I just want you to think about some of the things I said. And even if you do something good or bad, it doesn't matter. We're going to talk about how maybe you can revisit that and what could you say different the next time. So this could be helpful for professionals, for lay people, or for someone who needs to have the conversation with somebody. Is anybody willing to do that with me? And we could skip that part too if Erin, you think we need to for the sake of time.
It just depends if anybody's interested in role playing with you about it.
Anybody interested? I know that's hard because you didn't come on the call to be a speaker.
I can do it with you if you want.
Jody, you sound so excited.
Yeah.
Okay, so I'm going to play that. And I don't know what the word is. I think I used the wrong word earlier, but I'm just going to play probably who I'm going to be in if I end up with dementia in 80 years being a nurse. So I'm going to play obstinate, and you are the adult daughter, and you've had your meeting with your siblings. You have 3 siblings, let's pretend, and you're ready to go in and have the conversation with mom. And I'm mom, even though we're around the same age, I think.
Okay, so you want me to start?
Yep.
Hi, Mom. I'm so glad you came over today and we can enjoy this nice lunch together. I wanted to chat. How are you?
I'm good. Why am I here?
Well, I like to spend time with you, and I thought we could sit down and discuss some important things.
What are we having for lunch?
What do you want for lunch? I'm getting takeout. I'll get you whatever you want.
Ooh, I want Mexican food. Tacos.
Awesome. All right, done.
I don't even want to think about my diabetes today.
Oh, okay. Well, we'll get something special for you. I just placed the order. It'll be here in 20 minutes. So let's
Great.
chat so we don't have to, we can enjoy our food.
Great.
So I wanted to talk to you about, I feel like we should be doing this in reverse.
Oh.
I just wanted to talk to you about, what you want life to look like if you ever get sick.
I definitely want to make sure that I could do whatever I want. You know that I was like a charge nurse forever, and I'm used to doing things my way.
So what is doing whatever you want look like to you, Mom? Like, help me understand what that means to you.
I want to make sure that I can spend time with my friends and that I can still go to the store. I like to clothes shop.
Yeah. Well, that's awesome. Well, I know that, last week you had some trouble in the shower, And, you know, when you slipped and you were lucky that you didn't hurt yourself, remember that?
No, I don't remember that, but if you say that happened, I believe you.
Well, it did. And I'm just a little concerned that maybe there might be a better place for you where you could be with your friends and go shopping, but also have help like 24 hours a day in case you need it. What do you think about that?
As long as I can be with my friends and I can afford it, and you think it's a good idea, I want to make sure that I understand where you're thinking about. What are we talking about?
Well, you know what? There's a couple places nearby. So let me look into them and I'll get back to you and set up some appointments because obviously I want you to see them and be happy. So, and I know that some of your friends live at some of those communities. So let's go visit some of your friends and see how they like it and go from there. And I'll remind you about this in case you forgot because I'll set it up for next week. Okay?
Perfect. Sounds good.
Okay.
You did a great
thanks,
job,
Mom.
Jody. You did great. You know why? You used the open body language. You smiled. You focused on what I would want. You used open dialogue and you made it about me. So, and that's why I reversed it. I mean, I could have done the other where I was the, family member. So, Jody obviously has experience with this because she works, at Belmont and works with families all the time. So I can't say anything negative about the way you did that. So again, it
I'll
isn't
try
always
it
going
out
to
with
be
my
that easy.
parents and let you know how it goes.
Well, with your own parents, generally they always see you as the little kid daughter, and they will never share with you how they're struggling compared to, with the professional comes in. Doesn't matter who the professional is. Even if you have more, letters behind your name and credentials and expertise, and you work in senior living, they usually don't. But once in a while, you have that functional family that gets along. So the things that you want to think about again is financial discussion. That's going to be later. That's not going to be on your first conversation with mom or dad. I'd say every single client I've ever had, except for maybe two, thinking about nursing, they don't know what mom or dad has. Do they have enough money or not? Right. So that's going to be down the road. Again, make sure it's in the right setting, that you're having the right person talk, not somebody that they don't get along with. They might love their daughter or son, but they might not get along with them. That it's open communication about their wishes, which Jody did a great job. And bring in the professional if you need it, whether it's a community, a care manager. Something else you could do, which Jody brought up, is visiting the community. So you may say, what are your thoughts about it? And they say, they're going to have these misperceptions about what it looked like 30 years ago, like a nursing home feel. So set up a visit, whether it's an activity, a lecture, a lunch. Some of the communities, I think, I'm assuming Belmont does too, has a lunch that you can set up with your loved one. I'm not talking about weekly. I'm talking about when, you're thinking about touring. Maybe you do the lunch without the tour. Talk to, especially if you're the daughter or son, talk to the community about triggers that they would not want to say to mom or dad, or things that would be helpful. Dad used to be an accountant and he likes to talk about his office and things that he did. So that's a great icebreaker, right? For the community to have, or a care manager to have with them. Keep it short. If it is, a sales person that's walking the person around, of course, everything about the community. But with someone who's going there for the first time to tour and they're very hesitant and this is their first tour, or they didn't want to be there, or it took a lot to get them there, try to keep it shorter, try to keep it more about what their questions are and hit the highlights of what the family member said would be important to them. Ask about what their perception is at the beginning, because they're probably going to have some perceptions from years ago. I mean, assisted living and memory care communities are beautiful places with lots of fun energy and good people, lots of expertise around to work with, and keep people safe. Do not go visit a community if you have a client that has severe dementia. That doesn't always work. And if somebody has specific questions, and I will tell you the truth how it works, when you have someone who's severe dementia with behaviors, paranoid, et cetera. So if anybody has a question on what to do with that, I had one actually from somebody within your community last type of call. So
Jean, this is
the
Erin.
la-
Can I add one more
Sure.
point? Would that be
Yeah.
okay? So
Oh, yeah.
one other thing too to keep in mind, if you're worried about, if your loved one is worried about going to a community for a long period of time, you can always do a short-term or respite stay. All communities offer that, or most communities offer that, where your loved one comes for 30 days. And it's a nice way to kind of introduce them to the community and say, Mom or Dad, you know, why don't we try this out for a few weeks and see if this is going to work? And then sometimes it helps with them thinking, I don't have to stay here a long time. And then the hope is that they're going to really, really like it and benefit from being in a community, and that they're going to stay. So that's just another option I thought I would throw out there.
No, that's great. I'm going to add a slide in because it's absolutely, or your daughter or son is going on, vacation, and they need to know you're safe during that time. So it could be a respite to long-term stay, or it could be a short-term stay, which is, that's an excellent point. I'll add that in. And then I was thinking about something else you said about the respite stay. It'll come to me.
30 days.
30 days is
30 days is a typical respite.
okay. So that's the average what people do.
Correct.
Okay. I remember what I was going to say. One thing I will throw out there for clients that have pretty severe dementia, the people in a community are very, very trained, well trained to work with your loved one they come in. The daughters or sons have a lot of guilt if it's for spouses. And every single time, like just working as a guardian care manager, thinking about that, and as a nurse, moving someone in, when they say, I want to go home, and they have really bad dementia, we don't say, I say, okay, we'll go home. We'll get there. They're going to think this is their home. It just takes a very short window of time. And I'd love I don't know if Erin or Jody, you could speak to that on your end, what it looks like. So that the daughter or son has so much guilt, you guys are going to bring them and take them around and make them feel special. And you have the box with the pictures, and they can bring like a stuffed animal with, and I'll let you talk about that.
Oh, absolutely. Like you said, our staff is very well trained to help people with all different types of dementia loss or assisted living needs, and helping with the art of distraction is very helpful. Like you said, Jean, if they want to go home, saying, we'll get home, and then just, showing them an activity or bringing them to a different area of the building. And so that you're not upsetting them by saying, no, you can't go home right now. This is your new home. Just trying to distract them with something else. So, and it usually takes, in my experience, it usually takes 30 days for somebody to transition to a new place. So I always tell families when I meet with them that their loved one is probably not going to be real happy in the beginning, and that they're going to say, I want to go home. This isn't my home. I want to go home. But that after a few weeks, they will start to feel like this is home. They will settle into a routine, and then things should go smoother at that point.
Thank you. That's good feedback. So, I did add 2 slides in here too, what dementia and MCI are, mild cognitive impairment, but we didn't go into that because we're talking about just general, if somebody had dementia or any kind of needs to move into a community or needs care at home to start. Does anybody have questions or anything that you could think of that you'd want to bring up, or maybe something I didn't bring up during the conversation that's helped for any of you?
I actually have a question. My name's Susan. I have in-laws who we are trying to move into a community, and they don't have any diagnosed dementia, but are very resistant. We've gone to all the places, we've set up appointments, we've tried to, be respectful of their wishes and things that they're looking for. And then when we've, talked about it and presented it to them, they are 100%, I am not leaving my home. This is where I live. And mostly the husband, not my mother-in-law. She kind of knows she's the one who needs the most care and knows she needs to be in a place, but is definitely deferring to her husband. That's just the way that they've always been. So he is adamant. He's not leaving. He's taking care of her. He doesn't need our help, even though my husband's living there, 24/7, taking care of her. And I don't know. I don't know what to do.
So who's the person that he listens to the most? Is it your mom?
No, I would say he listens to my husband. He's a little more comfortable with hearing things from men as opposed to women.
Yeah.
Is my perspective.
Sure. So with your husband, has he, he's the one that's more resistant. Has he asked him any open-ended questions like what, sounds like there might be, I'm just taking a guess, fear there. He works with men and he's the caregiver for your mother-in-law. And there's some kind of fear. Sometimes people are afraid they can't be in the same room together. And they're these, you've toured, communities, there are these cute little rooms. So there's something there with, it sounds like maybe a fear, but if you ask that open-ended question, and I would have him do that, your husband, one-on-one with him, like, you mentioned you're interested, you wanted a tour, we narrowed it down, and you're not interested. So tell me about it. Maybe don't use the word fear, just say, tell me about it. What is it about it? And then it's probably something that he's got some kind of perception there. The other thing is bringing in a professional, somebody from the community or any care manager. Also, this is honest though, and this is the truth. Does he feel like he's a burden to you at all?
I don't think so, because I feel like it's a pride issue. Like, he can take care of his wife, even though really he can't. She's fallen 4 times in 6 weeks. He really isn't able to lift her by himself. They'll call us at 3:30 in the morning, and call 911 too. So, but it's like, nobody's going to tell him that he's not doing right by his family. It's a very like old school kind of, I don't know. It seems to me like a lot of pride. And I do think there is some fear in going to a place, because I think even though he has seen them, he feels like he's going, like that would be a place where he's going to go to die, he equates it with something very negative.
Gotcha. And a lot of people, seniors do, because they're looking at what it used to be. So that would be bringing in, the community to talk to him about, or the doctor, or your husband about what does a community do for you for independence. So you got to focus on the independent word. When you talked about her having falls and having to call 911, he's got pride. He wants to take care of his wife. Yes, we know you can take care of mom, and we know that you do a great job. But when she falls, I'm just throwing a number out there. She falls, she's 180 pounds. Yes, you're strong. I know you can lift her, but you've got to stay as independent as possible to continue to take care of her. And with help, not that a nurse's aide is going to be lifting up, mom, but in general, with help at a community, getting the right devices in place, and the flat surfaces and all that good stuff, right? The safety precautions,
right.
Accessible, all that. You are going to have the opportunity to continue to care for her, but make sure that you stay independent too. It sounds like it's more about, and telling him you get to still take care of her, conveying that message. You get to be independent. We get to protect her health, because his back is going to fail from picking her up. And you don't want to say your back's going to hurt her. You just, we want to make sure that you get what you need also in lifting her. You're going to hurt yourself at some point. I would too. Your son, your husband should. I would too. Anybody can hurt themselves with their back or whatever. We got to make sure you're doing well, because you do have another 20, 30 years. Even when I'm working with, seniors that are in their late 80s, I say, you have another 20 years, because there is this fear, all of us, with death, all of us, have, Americans.
Thank you. Those are great suggestions. I haven't come at it ever, or my husband hasn't, about the community and that it might be giving him more independence as in terms of less than. So those are good
And
suggestions.
another thing, don't say they're going to take over all the care for her, because they're going to be in a, hopefully, they get their assessment done and they're in the same room, same apartment.
Mhm.
It's going to allow him to still take care of her, because the community's there, but they're not in the room all the time. It's him and her. So you still get to take care of her, but then you get to go, I don't know what he likes to do, but throw that out. You get to go
Okay.
whatever activity he loves that's there. You're going to be able to go do those things or go out with your friends, whatever speaks to him. He's got to have a light bulb
Okay.
moment. What I was
Okay.
going to say earlier, though, just so it doesn't get, so don't go the wrong path or get misconstrued or say the wrong thing. Sometimes it sounds bad, but like when they're like, I'm a burden to the kid, it's too much taking care of mom. You're taking so much time out of your schedule. Guess what? In a community, I can come visit, but I'm not here, because I do need to go to work. I'm not doing this 15 hours or 20 hours a week, whatever it is, 6 hours a day. And this is if he was saying something like that, but he's not.
Right.
Like that it's putting pressure on your husband. But it's not a guilt thing. It's just the truth. Like, I get to go spend time with you as the daughter or son if you go get this help. But in your case, that won't work. So I'm glad you felt it was helpful.
Yeah, thank you so much. I appreciate it.
Anybody else have any questions or comments?
What's the new name for the DNR?
Oh, well, the form that you would use, you could still use the old DNR form, which they used to have on orange paper, that people still have, and they're still fine. They're grandfathered in, but it's called a POLST. It's a practitioner order for life sustaining treatment. And it allows you to put all your medical wishes on there. And then there's extra lines. I love filling those in, like, certain instances people get, they want to make sure certain things are carried out. I'm going to give you mine. If I'm ever a paraplegic and they think that in a car accident and they're going to do surgery, I don't want it. And I just had my powers of attorney done again. And I do have my pulse started, and that's in there. I don't want to live like that. That's me personally.
So if you have your DNR and all of the paperwork already done with a lawyer, it's totally legal and you can save it. You don't need to change anything.
So the powers of attorney you could do offline. I suggest you go to an attorney. I went to an attorney for mine. The POLST is done by an advanced practitioner or a doctor. And the attorneys don't always, some of them, I try to educate them. They recommend somebody going to that next step. They usually don't. But if you don't have that form, and say, example, I don't want resuscitation, don't jumpstart my heart. But guess what? 911's called because I'm down. I had a heart attack. They call the paramedics. They're going to jumpstart my heart unless I have that form that says I don't want to be resuscitated. So in some cases, it's really important you have it. I think it's important for everyone because it tells the power of attorney what you want or don't want in certain
But if you
instances.
have the other paperwork already done,
yeah, it's fine.
Then it's fine. Okay.
Yeah, the old DNR form. I misunderstood. Yeah. So the POAs are done by the attorney or online, whatever you decide. And then your old DNR form is fine. Yeah. So thank you so much, Belmont, for having me. I hope that was helpful. And I hope you invite me back.
Thank you so much, Jean. We really learned a lot. That was awesome. And I really appreciate your time and expertise. And I think everybody learned a lot. And thanks to everybody for joining in today. Have a great day.
Thank you.